I'm Cynthia Anderson. I'm an assistant professor in the University of Wisconsin School of Medicine and Public Health, and I'm in the Department of OBGYN. I am the medical director at the Arboretum OBGYN clinic, which trains all of our residents, and I'm also the Jeannie Bissell Professor of Reproductive Justice. Our department is very committed to making sure that women have access to whatever family planning methods they decide is best for them. And there's a lot of methods available, but the newest evidence shows that long-acting methods like IUDs and implants are the most effective, and they're very highly associated with patient satisfaction. So they're really recommended as first-line contraceptive methods for women of all reproductive ages. UW Health has a pretty robust infrastructure for doing health system strengthening and also internal quality improvement, and we're hoping to be able to collaborate and partner with that internal infrastructure to implement a couple of really high quality and evidence-based interventions to make sure that all comprehensive family planning options are available across sites. The first is called One Key Question, so that all women of reproductive age are asked about whether or not they plan to have a baby within the next year. Women who are planning to conceive can then get access to really good preconception care, including prenatal vitamins and smoking cessation programs, and making sure that they're eating a healthy diet and getting exercise, optimizing their weight gain before pregnancy. Women who are not interested in conceiving within the next year would then be able to get counseling about all their different contraceptive options, and if they're already using a contraceptive method, assessing whether they're happy with it. If they decide that they want a long-acting method like an IUD or an implant, we want to guarantee that they can get that service as quickly as possible. We also know that some providers aren't as well trained because these newer devices require office-based procedures to insert them, and we want to make sure that we provide training to any providers in our health system that are not currently trained that would like to be able to offer those services. Women in the community face a lot of barriers when it comes to accessing services: transportation barriers, language barriers, insurance barriers, delays in seeking care because of unavailability of appointments. So we'll be looking across our health system at ways to improve all of those things. We've been collaborating on research. We've been collaborating with community partners. We're looking at other efforts that might be able to make impact not only within our own health system but in the state, including possible collaborations with federally qualified healthcare centers or other women's health clinics, and trying to make sure that all the right stakeholders are involved so that we can improve access to really high quality contraceptive services for women across the state.